This image from the book probably provides the best overall picture of how respiration works. Respiration involves inspiration, drawing air in, and expiration, pushing air out. How exactly that works depends on the type of breathing. Regular, quiet respiration, when you're just sitting there breathing to give yourself enough oxygen to keep your bodily functions working, is pretty simple. Inspiration happens by contraction of the diaphragm, so that's going to expand the lungs in an inferior direction due to the pleural linkage between the diaphragm and the lungs. Expiration happens when the diaphragm relaxes and the lungs pull the diaphragm back to the resting state. The lungs shrink back down to their natural state if they're not expanded. You can inhale a larger amount of air with forced inspiration using accessory muscles to raise and expand the rib cage. And if you need to continue expiration past the resting state of the lungs, you can use accessory muscles of expiration to compress the rib cage and the abdomen further and shrink the lungs down even more than their resting state as a result. So for the process of inspiration, the diaphragm is lowered, the rib cage may be raised and expanded. Because the lungs are connected to the interior surface of the thoracic cavity, to the diaphragm, and to the interior of the rib cage, that's going to expand the lungs. Expanding the lungs is also going to expand the alveoli, which basically make up the internal structure of the lungs, kind of like a sponge. When you do this, the viscera in your abdomen get compressed, and the anterior abdominal wall gets stretched by the movement of the diaphragm, and also expansion of the rib cage stretches and twists costal cartilages. So for expiration, we have a certain number of passive forces, non-muscular forces, because we've stretched out the lungs, kind of like a balloon. They're going to shrink. In addition, those stretched out costal cartilages are going to want to return to their normal state, and those compressed abdominal viscera are going to want to return to a non-compressed state. So some expiration happens just by everything returning back to its resting state. We can begin to quantify the process of breathing by looking at what happens during a cycle of respiration. We have alternating inspiration and expiration, and if we monitor this over time, we can see a pattern that repeats periodically. One way we can quantify that pattern is by its rate of repetition. In the case of respiration, this would be how many breaths you take in a minute, for example, because each breath does take a few seconds. On the bottom of this slide, we have a graph showing cycles between inspiration and expiration. The vertical axis on the graph shows us the volume of the lungs relative to resting lung volume. So the 0 there would be the state that the lungs want to be in if you're just sitting there relaxed. A larger number, as happens during the inspiration part of the cycle, comes from expanding the lungs and increasing the lung volume relative to resting volume. Expiration happens when you decrease lung volume relative to the resting volume. For quiet respiration, this would just bring you back to the resting state, like shown in this image. In this case, we have one cycle of the breath that takes 10 seconds. So that would give us a total of 6 breaths per minute for respiration, as represented by this graph. Other measures of respiration include the volume, which can be measured by a spirometer. A spirometer has an air chamber connected to a recording device. You breathe into it through a tube, and it can determine how much a moving diaphragm inside the device is moved to figure out how much volume of air you've expired. Air gets moved around by changing air pressures, and air pressure gets measured by a manometer. The image that's on this slide is an example of a manometer where you use displacement of water to indicate how much pressure there is. As you breathe into the tube, the air pushes on the water, and the column of water inside the device gets shifted by a certain number of centimeters, giving us a measure in terms of centimeters of water for what the air pressure is. So for quiet respiration, we have quiet inspiration followed by passive expiration. If we measure that in adults, we typically have a respiration rate between 12 and 18 cycles per minute, about 500 milliliters or 1/2 of a liter volume of air exchanged, a pressure change of about 2 centimeters of water. That would be a negative pressure for the inspiration part, lowering the pressure in the lungs to draw air in from the outside, and a positive pressure during the expiration part, increasing air pressure inside the lungs to force air out. During quiet respiration, inspiration and expiration are also relatively even parts of the cycle, about 40% of it for inspiration and about 60% of it for expiration. The graph that's on the right there shows various measures of respiration. I've marked one cycle with red lines. We can measure respiration in terms of change in volume, in terms of the rate of airflow, in terms of the air pressure in the lungs, also known as alveolar pressure. This particular graph also shows the pressure between the pleura, but I don't know of any important measures of that for our purposes for speech-language pathology. And then last but not least, it also shows activity of the diaphragm muscle. So focusing on the volume and the alveolar pressure and the diaphragm activity is the most relevant to us, I think. You can see the lung volume increase and decrease in one cycle. The alveolar pressure go from negative during the inspiration part of the cycle to positive during the expiration part of the cycle. And diaphragm activity during the inspiration phase, then the diaphragm relaxes and passive forces cause the expiration phase. For a typical adult, the resting respiration rate is 12 to 18 breaths per minute. When you're walking or doing light exercise, that respiration rate will increase a little bit. If you exercise very heavily, the respiration rate can more than double. Respiration rate is known to change over the lifespan. In newborns, the respiration rate is much higher than it is in adults. So for a newborn, a respiration rate of 60 breaths per minute or 1 breath per second. Through the first few years of life, that respiration rate drops dramatically and becomes much closer to the average for adults by the time you're, say, 5 to 10 years old. Here I have an example of 4 graphs showing a change in tidal volume over time. We have this idea of a respiratory cycle of inspiration and expiration. And one question of your understanding of that cycle would be which of these 4 graphs shows us the highest respiration rate. What does the highest respiration rate mean? The highest number of breaths per minute or breaths over time. So the one with the most cycles, that would be the very first graph in A.